Welcome to Policy and Governance Perspectives, the official podcast of the Schar School of Policy and Government at George Mason University. Join Dr. David Ramadan and Schar School experts as they engage in thought-provoking conversations with elected officials, policymakers, and thought leaders. Listen for in-depth discussions on policies, politics, governance, and career pathways, all designed to elevate your perspectives and expand your mind.
Welcome to another episode of Policy and Governance Perspectives, the official podcast of the Schar School of Policy and Government at George Mason University. Today's guest is a real-life medical detective, and this conversation hits hard. A Manhattan Project-style overhaul of pandemic preparedness, why lockdowns don't work, and what should have been done instead, Joe Rogan's podcast, and the sobering truth about whether more lives are lost to microbes or to war. Stay with us. This one is packed. Today's topic, pandemic readiness, vaccine integrity, and global health security. And few people are better suited to lead that conversation than our guest, Dr. Michael Osterholm. He's a globally recognized epidemiologist, Regents Professor at the University of Minnesota, and Director of the Center of Infectious Disease Research and Policy, CIDRAP. He's advised the CDC, the U.S. Department of Health and Human Services, the World Health Organization, and even served as a science envoy for health security at the U.S. State Department. His new book, The Big One, How to Prepare for the Next Pandemic, confronts the question we all should be asking. What if the next outbreak is worse than the last? Joining me as co-host is my colleague, Dr. Gregory Koblentz, Associate Professor and Director of the Schar School's Biodefense Graduate Program. Gregory is one of the country's foremost experts at the intersection of health, science, and security. He's briefed the UN Security Council on bioweapons threats and leads the Global Biolabs Initiative, tracking the world's highest security labs. Together, we'll unpack what we've learned and haven't since COVID, what the real risks ahead look like, and what it takes to ensure the next pandemic doesn't catch us off guard. Gentlemen, welcome. Let's start with segment one, setting up the stage. How does science meet security? Michael, briefly walk us through your career path and how it led to the creation of CIDRAP.
Well, first of all, let me just say that I was very fortunate as a young boy to have in my life a woman in this small Iowa farm town that I was born and raised in who actually subscribed to the New Yorker. I think she was probably the only person in all of Iowa at the time that subscribed to the New Yorker, but she did. And included in the New Yorker from time to time was an article series called Annals of Medicine. And it was by Bertrand Roget, the famous author who wrote a number of interesting stories that were all about disease investigations that at that time the Communicable Disease Center had done, and that it was kind of a whodunit mystery issue. I read that first one when I was in 8th grade, and I knew at that point I wanted to be a medical detective. So literally from 8th grade on, I've spent my life living out that varied dream. I graduated from a small private college in Iowa, where at the time when I graduated, I got called into the office of the professor who headed up political science, chastising me for not having filed my topic for my senior paper. And I said, "What do you mean? I'm a biology major." And he said, "Well, you have enough credits to be a political science major." And I think that was maybe the first shot across the bow to remind me that my career was probably going to be a mixture of both. The politics of science and the science of politics. And so from that, I then went to the University of Minnesota after graduating. I've been there now since 1975, 50 years. I've been affiliated with the U. And at the time I was in infectious disease epidemiology, many people wondered why, because it was going to the horse and buggy years. That at that point we had really solved all the big problems. Well, as you can see, we haven't. As I started as a graduate student at the University of Minnesota, I also began as an intern at the Minnesota Department of Health and I stayed there for 25 years, eventually taking over the infectious disease area and building it into what program it eventually became. And the entire time I was at the University of Minnesota, and I'm still there today. But as all of that activity, I also took on a number of other tasks. For example, I've had a formal role in every presidential administration dating back to Ronald Reagan, where I was involved with helping to support the HIV/AIDS Commission at that time. And every administration since then, Trump won, I was a science envoy for the State Department, traveling around the world to better prepare ours for an eventual pandemic, which then did come 2 years later, and I'm not sure we're much better prepared. I was on the Biden-Harris transition team on COVID. And so I've really had you might say, a politically agnostic career. I served 2 Democratic governors, 2 Republican governors, and as we affectionately say in Minnesota with Jesse Ventura, 1 independent wrestler as governors. And no one can tell you my partisan politics. I've always just been a private in the public health army, trying to do my job to do my job. And so from that standpoint, I've always seen the relationship between public policy, science, research, and policy, which, of course, CIDRAP is so well named for today.
Thank you, and thank you for that service, and thank you for that independency. We need more and more of that, especially during the polarized times that we are living in today. I think I just found from your first couple sentences the title that I'm gonna use for you, even though you have probably 20 or 30 of them that we can use. Medical detective. I love that.
Thank you. Thank you
for this podcast. All right. So what did you see, Michael, back then that others didn't when it came to pandemic threats?
Well, I had the very good fortune to come under the tutelage of D.A. Henderson at Johns Hopkins. So even though I was in Minnesota, our paths crossed early in my career. And D.A. and I became very dear friends. And as a part of that relationship, I also began to see some of the big global issues that he talked about. And as early as the early 1990s, late 1980s, I grew very concerned about our potential preparedness for a pandemic, notably thinking it would likely be an influenza virus coming again. This is at the same time, but of course, we were working with HIV/AIDS, drug resistance, what was happening in the developing situation with vector-borne diseases, etc. But I always had in the back of my mind, what would it be like for that big pandemic to occur? And so as early as the late 1980s, I began really addressing that. I wrote about it in a book that I wrote, Living Terror is What Our Country Needs to Know to Survive the Coming Bioterrorist Catastrophe, which was really about bioterrorism, but it also emphasized our preparedness for a pandemic. And then in the early 1990s, I actually participated as part of the U.S. government response to what was happening in the former Soviet Union, Russia, and the decommissioning of all the biologic work that they had done in terms of weapon development. And so I spent a fair amount of time working on that issue and working with some of the former Russian scientists to better understand what had happened there. And so it was really way back then that I recognized this situation. In 2017, I wrote a book, Deadliest Enemies, Our War Against Killer Germs, and I actually laid out in 3 chapters what a pandemic would look like of a severe nature, and specifically addressed it as an influenza one, but fully cognizant of that it could be a coronavirus one. In fact, one of the chapters in that book was labeled SARS, MERS, a harbinger of things to come. And so for me, this is, we might say, unfortunately, a long-term journey that I've been on with regard to pandemic preparedness.
Thanks for that. Gregory, the floor is yours.
Thank you, David. Great talking to you, Dr. Osterholm, and I'm a big fan of CIDRAP and all the work that you do there. From my perspective, one of the real strengths of CIDRAP is that it conducts research on both public health in the United States, but also on global health security issues. So I'm just wondering, how do you see the relationship between public health here at home and in other countries?
What I think we learned very effectively, or at least we should have, with the COVID pandemic, boundaries are irrelevant. They don't really define anything for us except potentially how the local response might take place, but they surely don't define what the infectious agent is going to do. So as we're seeing right now in the world, the changing aspect of vector-borne diseases because of how we're moving vectors around the world with human transportation. We're seeing the issues of what migratory birds can do in terms of moving viruses around the world as we look specifically at influenza viruses. We're seeing many aspects of a world very different than our great-grandparents grew up in. Think of the issue of dengue and the fact that, when we look at dengue as a disease, at one time it was associated with 4 different serotypes of virus located in 4 distinct areas of the world, and they did not overlap. Today, all 4 of those serotypes are everywhere. And again, now, as opposed to just getting breakbone fever, if you've previously been infected with a dengue virus and you have some antibody present, you're now at risk for dengue hemorrhagic fever and this very serious, life-threatening disease. And that's only occurred in the last 50 to 70 years because of the fact that before then, the 4 distinct viruses meant that you didn't have to worry about a second infection with a different serotype that would cause this immune enhancement condition to occur. So, I think what we have to realize is today, boundaries are to a very real degree irrelevant, and every infectious disease that's somewhere in the world tomorrow could be anywhere in the world, and we never must forget that.
Yeah. So in light of that, kind of the global nature of these kinds of threats, I realize you finished your book shortly after the Trump administration entered into office and started imposing sweeping cuts on the whole range of public health institutions in the United States. How has that affected the work that CIDRAP does, and how do you see the role of CIDRAP evolving given these new challenges to public health?
Well, it's important to note here that I am 72 years old, and people have, I think, been ready to put me out to pasture for a few years, okay? But let me put context to that. On the night of the election last fall, I recognized once it was announced that Mr. Trump, in fact, had won, that public health was in for a very, very difficult period ahead. I actually spent the better part of that evening staying up, rereading Project 2025 and looking specifically at the areas around public health. Obviously, I was well aware of the fact that Mr. Kennedy had played a very key role in the in Trump's re-election efforts, and that he was going to play a key role going forward. And so the next morning after the election, I wrote an email to my staff and said, well, you got me for at least 4 more years. I'm not leaving. I can't. This is going to be a too important time. And I really thought about it in the context of the fact that this was really about my kids and grandkids. What kind of world are we going to leave them? And I anticipated this. I wrote an op-ed piece in the middle of November in the New York Times in which I called out the fact that vaccines were going to be severely threatened, the entire vaccine enterprise system. And I think there were a lot of people that were skeptical, it can't really be that bad, only to find out that as time went on, it was that bad. In April, we actually launched at CIDRAP another program called the Vaccine Integrity Project with unrestricted support from the Alhambra Foundation, Christy Walton's personal foundation. And the first thing that we did is we did 8 focus groups around the country with individuals all the way from those who are at the most basic R&D aspects of vaccine research and development to those who are the people who deliver the vaccine into the arm. And we asked them a series of questions about if, in fact, CDC was no longer able to provide science-based recommendations free of political overtones or review, and something happened to the ACIP, what could a non-governmental organization or organizations do? And at first, I think there was some skepticism again about, well, you're trying to be another ACIP. We have an ACIP. But then I think everyone realizes what happened in June. By that time, ACIP had been disbanded or fired, at least the current members. And we saw that more and more of the information coming from the CDC and the FDA was heavily politically tainted, and that the CDC scientific community was not providing the input to the leadership of HHS. So we did launch a full-flamed effort with a vaccine integrity project. And the first thing we did, recognizing what the focus groups had shared with us, is somebody needed to have the kind of information that could allow for the recommendations for the fall vaccines, the classic respiratory fall vaccines of COVID, influenza, and RSV. And so that was not going to come out of ACIP. So we embarked on what was truly a Manhattan Project-like effort. In a period of 3 months, we did what normally would take 9 to 12 months to do, and did a complete protocol review of all the information that had been published or made available since the time that the ACIP last reviewed these diseases. We then shared that information as we went through our work with all the medical societies, who then often used it as the basis for making their recommendations. This were different than what ACIP now reconstituted with a largely anti-vaccine or vaccine-hesitant population of experts. And we continue to do that kind of work. Ultimately, that paper was published in the New England Journal of Medicine, showing what we did. A 166-page appendix is included with it in the on the internet site, and as well with the fact that we actually created a tool on our website, so you can go in and do exactly the same analysis we did. All the papers, abstracts are all there, totally transparent. We're continuing to expand on the VIP. We've got a number of different projects. We're now pursuing a very detailed review of the hepatitis B vaccine, because that's likely to be taken up soon by ACIP, in which there are those who want to eliminate the newborn first dose vaccine approach, which has been highly successful in reducing hepatitis B in young children in this country. So we have a number of other areas that we're still working on with this, but I think right now the Vaccine Integrity Project is really our primary focus moving forward to deal with the science policy interface around vaccines.
Michael, the big one. Lessons from the past, warning for the future. You started your book, you opened your book with a fictional outbreak of SARS-3. Why start with fiction? And what message are you sending to policymakers?
Well, one of the important tools in all of public health and what we recommend and how we carry out our programs is in part tied to storytelling. Can the public understand what it is that you're trying to do in ways that are reality to them, not some abstract policy approach? The scenario that we paint is one that develops throughout the entire book, but it builds on it chapter after chapter. So the very first part of it is, what would an emerging pandemic look like? And I think one of the important messages there is, contrary to what some people say, you can't prevent pandemics. You can't. Once a virus with wings, as we call them, and notably now it's influenza and coronaviruses, and sure there could be other virus candidates coming down the pipe. Once a highly transmissible respiratory transmitted virus is out, it's out. It's gone. Now, what happens next is critical in terms of, will we have vaccines that are effective? Will they be readily available? Which will be the primary first response. And so what we wanted the readership to understand is, this is what it will be like at that point. And the decisions that get made or don't get made will clearly impact on that. And so each chapter is related to a different nonfiction topic, whether it be mandates or vaccines or all these issues. And then how does that relate to reality? How would a government respond? And the characters in this are human. And part of the challenge we have is we have to unfortunately recon on humans to drive and run pandemic responses. What are the issues there? What happens in the hospital bed? What happens when those who believe that this has all been made up and share such mis and disinformation? So once you really are grabbed by that, it makes it easier for you to understand the arguments at the time of what we're talking about. And so that was the key piece. What this book really reflects was I had the good fortune to be at the front row table with regard to much of what happened with the pandemic. I believe on January 20th, when we put out a statement saying, January 20th of 2020, by the way, that this was the next pandemic, get on with it. I think we were the very first organization in the world to declare this. It still took WHO almost 2 months later before they would do so. And our effort was really to help people respond. We had, again, a lack of the understanding of what was going to happen and some creative imagination, in that we were so concerned about the virus coming in from China, we fortified our ports on the West Coast, whether they be air, land, or sea, and we forgot all about the East Coast. But that was where the virus came in via China to Italy to New York City. And that was another example of we should have and could have anticipated that. And not that that would have changed the course of the pandemic as such, but it was a lack of that kind of thinking. One of the other areas that we try to cover and comes out early in the pandemic scenario is the fact that you have to be prepared to respond to this for the next 3 or 4 years. I was on the Joe Rogan podcast on March 10th of 2020, and I actually said this is going to last at least 3 years, maybe more. And if that's the case, we could see up to 100 or up to 800,000 deaths in the first 18 months. Well, you might have thought I was saying something very negative about your mother. You know, people did not take kindly to that. They're saying, oh, that's just exaggeration. 18 months later, we were at 790,000 deaths in this country. And I think we lack that creative imagination to understand that. Well, if in the scenario you'll play it out that way, it helps then the reader understand, oh, okay, I get it. That's what the assumptions are. And I might add, in the big one, we don't even make it the real big one that it could be. When you look at what SARS-CoV-2 did, this was a highly infectious virus that killed 1 to 1.5% of the people infected. If you looked at what were to be the case if SARS or a MERS-like virus gained the capacity to be transmitted as effectively as SARS-CoV-2 or COVID, and had a 15 to 35% case fatality rate, as we saw with those individual outbreaks of a much less highly infectious virus, think what it would be like. That would be a big one. And in our scenario, we don't even go that far. We end up saying 7 to 7.5%, which is half of what SARS was and only a quarter of what MERS was. So I think that's the whole purpose, was to help people come into context with what is happening at the time. What's the situational awareness that you need to be mindful of, because this is what's happening.
Scary numbers for sure. We don't have the listenership yet of that of Joe Rogan, but for our listeners at the Schar School, for our students, for our professors, and for our ecosystem, what are the top 2 or 3 lessons from COVID-19 that the public and policymakers still have not absorbed?
Well, let me say that there's an overriding foundational issue that really is front and center. And that is the fact that, I had the good fortune after 9/11 to actually work closely at HHS with Secretary Thompson and working as an advisor to him out of his office. As I mentioned before, I'd written the book Living Terrors about bioterrorism and so forth the year before 9/11 happened. During that next 3 years, I split my time between Minnesota and HHS. And I also got in on the early days of the bipartisan 9/11 Commission. And I watched a remarkable process take place where it was co-chaired by a Republican and a Democrat. There was no evidence at that time of finger pointing, blame. Everybody assumed we all are accountable here. What can we learn from that event that we can do something about now to, 1, make sure it doesn't happen again, and 2, if it does, how can we better respond? That report has been invaluable. Well, my great hope was that we would see a similar situation occur with the COVID pandemic. What should we have learned? How could we have learned? We remain fixated on a topic for which there'll never be an answer, and that is, where did this virus come from? Was it a spillover or was it a lab leak? And having been involved with the National Science Advisory Board for Biosecurity, that oversight group that's supposed to basically lay out safe federal research standards, I was on that board from 2005 to 2014. And I was very concerned about lab leaks and the ability for that to happen. But I have to tell you, as somebody as objectively as I can, we're never going to know the real answer. And I think right now the data does actually support more that it was a spillover. But move on, because we have to be prepared for the next spillover or the next lab leak. And we're not doing that. We're not preparing for anything right now. And in fact, we're tearing apart our potential to be prepared. Case in point, if we had an influenza pandemic that emerged today, that was a 1918-like pandemic. It doesn't even have to be as bad as what we've laid out with SARS or a kind of MERS-like situation. We have, as a world, the capacity right now, because of our antiquated influenza vaccine manufacturing situation using embryoed chicken eggs, to make enough vaccine in the first 12 to 15 months to vaccinate a quarter of the world. That's it. We were working on developing the mRNA technology as well as several other technologies that could actually quickly bring us that vaccine and be able to vaccinate most of the world in the first year. Now, the difference between those two scenarios are millions and millions and millions of deaths. What happened? Well, $500 million had been invested by the previous administration in furthering the mRNA technology with influenza in such a way that we can have it all ready to go, done, approved. We know what the data are, and this administration pulled back off $500 million that had been allocated for that, and now there is no effort that way to move influenza vaccine forward in any meaningful way. And we happen to have a first row seat for that because our center, with support from WHO and several foundations, have maintained both the influenza vaccine roadmap and the coronavirus vaccine roadmaps, which are detailed, up-to-date, by the hour reviews of vaccine availability, research being done, who's paying for it, who's supporting it. So we have a really good thumb on the pulse. And we can tell you that there's been no acceleration. There's been no real effort to get us to better influenza pandemics. That should be a lesson learned. That is a highly, highly, highly risky vulnerability we have right now. And we know enough to know it's there. And we know enough to know we could do something about it. And we're not. So I think if I had to say anything, David, that was really important was we didn't learn the lesson that we should have learned the lesson. And number two is that there are things we can and should do and we're not. And we will pay a price for that someday. You know, when people think we'll suddenly magically pull a vaccine out of our hat the next time a pandemic comes along, that's like saying, I'm going to finish that aircraft carrier in 9 months, come back and get it, okay? Ain't going to happen.
Scary, Dr. Osterholm. Truly scary that that's the status or the state that we're in as a country. So basically you told me that we didn't learn anything. It's not that 2 or 3. And because of that fixation on where did it spill from, whether it's important or not, that we basically are policymakers, not you and I or Greg or people that are into this, but our policymakers in DC across the river from us didn't learn much at all.
And David, let me add to that very thoughtful comment. We did learn some things, but they've not been incorporated into any kind of a public document, program, or consideration. For example, I wrote an op-ed piece in the Washington Post in mid-March of 2020 and said, whatever you do, don't do lockdowns. Lockdowns will not work, okay? 41 states went ahead and enacted lockdowns, thinking that they're going to stop the virus. Well, that's like misunderstanding what a hurricane is. A hurricane is 16 hours, 20 hours in length, and then it passes and you go into recovery. A pandemic that's going to last 2, 3, or 4 years, you don't go into recovery. You get through it, and then you try to get through it again. And with the next surge, you try to get through it again. And one of the things I had proposed was in the early days of the pandemic, the only real weapon we had against this virus was good medical care. We didn't have a vaccine, we had no drugs, etc. And even our public health activities, this virus is so highly infectious that basically we were going to be challenged. So I had proposed, and it's in the book, we should have adopted snow days. And snow days in Minnesota are where for next few days, life isn't going to be the same. Well, what if we had every hospital in the country every morning post their census, 85% full, 90% full, 120% full. And when we got to a certain level, the public knew we're at that level, and we're saying, please, maybe now's the time school shouldn't be an act. Now is the time you don't want to have big public events. Now is the time, if you can work from home, work from home. And the public would have understood why, because you're trying to keep that number of hospitalizations down so that you're not trying to provide care in hospital beds and hallways and parking garage stalls. and think that would have been a good thing. And it's going to happen over and over again. It's not going to be done the first 6 months or the second 6 months necessarily. You're going to constantly try to curve that or shave that curve to keep it under a certain level. And that's a lesson we could learn for the future, is that. And by the way, we have greatly, greatly overstated the impact that quote unquote lockdowns had on our lives. Of the 41 enacted lockdowns that took place by governors in 41 states in late March, all of them but one were lifted by the end of June. And even in states like Minnesota, where the governor declared non-essential workers should stay home, 82% of our workforce was deemed essential. I mean, is that a lockdown? People perceived that. They realized there were, people didn't go to work. People didn't have big sporting events. People did close schools, but that was not from CDC. That was not because there was a national policy. It was people's reactions out of fear. But we didn't help prepare them for that. We didn't help get them there. So I think that's just one example of any number of things. We could be doing so much right now in respiratory protection. How do we actually improve our country? We wasted millions and millions and millions of dollars in hygiene theater during the pandemic. Those plexiglass shields, those 6 foot distance, did nothing to stop transmission of an airborne virus like that. And so I think that's another lesson learned. In the future, don't do that. What you want are people to have effective respiratory protection devices like N95s, and ideally you'd have improved a lot on their design, their usability, their reusability, etc. So there are lessons we could have learned and should have learned. We just haven't. But none of those are going to be realized if we don't even have the mindset that we need to do it, which is what my opening comments were about. We don't have that mindset yet.
Mindsets, practical solutions. I could go for another hour asking questions on that, but I'll stop and turn it back to Gregory.
Thanks. So, one of the current concerns out there is this global outbreak of H5N1 that's infecting not just birds, but also a whole range of mammal species, most notably cows here in the United States. But that outbreak really hasn't been on the news much lately. Do you think that's because it's under control, or we're just not paying enough attention to it? And is anything that you're seeing in the current strain of H5N1 that's circulating or that's evolving that you find particularly concerning at this point?
Yeah. Well, let me start out by saying, first of all, there is going to be another influenza pandemic. The pandemic clock is ticking for it. We just don't know what time it is. Will it be H5N1? I'm not sure. In fact, a year ago, when the outbreaks first occurred in the dairy operations around the country, was one of those, how shall I say it? Let's be careful here about predicting this is going to be the next pandemic. I've been involved with H5N1 dating back to the early 2000 time period. I was in Malaysia. I was in Indonesia. I was in Thailand, where the heart of the outbreak had occurred. And I was certain at that time that we were going to see an H5 pandemic and it was going to be horrible. Well, you know what? Nothing happened, and nothing happened, and nothing happened. And we get to the 2008 to 10 time period, and now we're starting to talk more about, well, the virus is changing though, okay, even though the case numbers are way down. I can tell you with exact clarity by the moment what it was like to be in a room at NIH in 2012 when 2 leading flu researchers came to the NSABB and presented data saying we are simply one mutation away from a pandemic virus. Okay? I mean, you could have felt the tension in the room. You could have cut it with a knife. And nothing happened. Then we get to 2015 and we see this big increase in cases that's occurring in Africa, in the Nile River Valley, among duck farmers. Largest outbreaks we've seen overall and more fatal cases than we'd seen in Asia. And what happened 2 years later? It disappeared. So we've had these experiences. We had 2015 H5N1 in poultry in this country when it first started moving in migratory birds. There's something about this virus that I'm not sure it will ever be capable of becoming a sustained human pandemic virus. It doesn't mean it won't. I can't say it won't, but I'm not sure that it is. I think the fact that we don't see the ongoing person-to-person transmission, with this virus. Even when we do get infection with the eye, that type of thing. We see very seriously ill cases. We just had a young child die in Mexico last week with H5N1. These cases occur, but will they, as a virus, sustain itself? I don't know. But let me just come back to the fact that there will be another influenza virus, okay, that will cause a pandemic, and we need to know it. And all I can say is I wish I know now what I will know one day when that virus finally arrives, and I'll say, oh, that's what it was, okay? So I don't know how to answer that beyond that, but I'm not one of those that believes necessarily that H5N1 will be the next pandemic virus.
Okay. In your book, you talk about the infodemic, right? That flood of accurate information, misinformation, outright lies that accompanies the real disease epidemic. And I know from personal experience that countering misinformation is very challenging. It's very labor intensive. It seems like every time you debunk one rumor or false allegation, two more pop up. So I'm wondering, what advice do you have for scientists and public health workers who are working to try and contain the infodemic during the actual outbreak?
Well, let's all agree that a lie can travel around the world twice before the truth gets out of bed. Okay, that's a challenge. And we're trying to study that and understand that at CIDRAP. We actually have an activity formally right now looking at social media, looking at different ways that different age groups, different ethnic groups get their information, how they process it. Where do they go for validation of their information? Is it the internet? Is it the medical community? Is it friends and family? And what does that mean in terms of then how they validate that information? And I can tell you, as somebody who, is an old timer who's now done over 200 podcasts, often lasting an hour, the average age of our audience is probably in their 60s. That is not childbearing women's aged population, okay? And so that we have to understand that in the younger age population, the 16 to 35-year-olds, you need to be able to deliver a message in less than 2 minutes. You need to do it in less than 300 words. You've got to understand who the people are that are the validators in the community. And so we're trying to understand that so that we can do a better job of actually getting information. I can just give you one very real lesson that we've learned. Never, never, never preach or get into an argument with people like this, because that'll only come off. And it really is important that we are able to communicate with them.
All right, we're getting to the end of our podcast. Michael, how do we prevent preparedness from becoming a political casualty again?
David, that is absolutely one of those issues I just mentioned. I wish I knew today what I'll know sometime in the future. I don't have a good answer. When the fundamental issue of whether vaccines should exist or not are on the table, it's very hard to think about things of less pressing order than that. And who will do that? There was no outcry when that $500 million were taken away from the vaccine research to develop better and more timely influenza vaccines. No outcry at all. And I think the challenge we have today is we are so immersed in just the survival of public health. I mean, look at CDC and FDA. They are shells of what they once were. Today, the leadership of both those organizations are largely politically appointed individuals with very limited health experience or public health experience. And so we're just fighting for those programs to maintain themselves. This is hard. But your point is really important. We've got to do it. There's an old oil fram commercial from the 1950s that used to say, you can pay me now or you'll pay me later. And this is a classic example of that very thing. And so we have to keep doing it. And, I have people often ask me, my age, why don't you just go retire? Okay. The book, The Big One, was a love story for me. It was a love story. It was a story for my kids and my grandkids. It was about the world that I want to see different than what the world is right now for those kids and grandkids. And I think that most people might be surprised to know that we provide a lot of solutions in that book that could take pandemics off the table as catastrophic. They still will emerge, but we could have such a major impact on them we could do so much more to provide a safer world from these emerging viruses. And at this point, I don't know what it's going to take, but I can tell you the mere fact that I sit at my desk right now, and sitting right over here is an 18-inch picture frame that every 30 seconds flashes a new picture of one of my grandkids or grandkids together. When I'm having a boring Zoom meeting, I never am bored, okay? Because all I have to do is watch that screen. And it reminds me every hour of the day why I do what I do. And so as long as those kids and those grandkids are not safe, I'm not done.
Thank you for doing what you do, Michael. Since we are a college or a university and the Shar School, I know you're going to be chatting with many of our students tomorrow. We're recording on the 11th. This is not going to play for another couple of weeks. And I know by the time that this is out on air, you would have chatted with some of our students. But for those that are preparing for careers in public service or global health that are not going to get a chance to talk to you directly during your fire chat with our students, what advice would you give them?
Don't give up. Don't give up right now. There are a lot of headwinds in so many areas of higher education, not just public service or public health. But the bottom line is there will be a new day ahead, and higher education will be valued. The challenges we're going to have are still going to be there to fight the bugs. I want to remind everybody that one very sobering fact is, if you look at the last century, more people in this country have died from microbes than have died from all the bombs and bullets combined. And we have to remind people that that enemy of Mother Nature and those bugs is every bit as severe as a foreign actor. And we would not for a moment think about diminishing or relinquishing our overall ability to respond to a foreign actor. Our problem is we just haven't figured out why we should be responding to these microbes. And I believe that future generations may have that opportunity. There may be a renaissance. I remind people often that out of the darkness often comes light. Many people do not realize that the Gutenberg Bible actually came as a direct result of the plague that hit the Middle Ages and killed so many monks who did the Bibles, who wrote the Bibles by hand. And so they needed a way of having mass production of a Bible, and the Gutenberg press came out of it. I go through a long list of crises that happened, but that ultimately resulted in good things. And I believe that'll be the case here. So students, be part of that. Be part of the change. Be part of the effort. And know that it'll not only be for your own benefit, but for the whole world. What an incredible way to live a life.
We are almost out of time. Any final thoughts, Dr. Osterholm or Dr. Koblentz?
Well, I just want to thank Dr. Osterholm for that optimistic message. That's certainly something that we need our students to hear, since we are training the next generation of students who are going to be working on these issues and trying to bridge that gap between the public health, scientific, and national security communities. And while your book is definitely a sobering read, I think you do provide a roadmap for the future of how we can be prepared for the next pandemic and try and make sure it's not as bad as what we've already experienced. So, thank you again for your service and for your book, and look forward to hearing more from you in the coming days.
Good. Well, thank you to you, David. Thank you to you, Greg, for having me. I appreciate it. And I hope most of all that anyone listening to this may come away with the idea there's something we can do about it.
Michael, thank you for your time and your work. Gregory, thank you for co-hosting this important conversation. Listeners, you can find Dr. Osterholm's new book, The Big One, wherever books are sold. You can catch all of our podcast episodes at char.gmu.edu/podcast or wherever you get your podcasts. I'm David Ramadan, and this has been Policy and Governance Perspectives. Until next time, stay informed and stay ready. Thank you all.
That brings us to the end of another insightful episode of Policy and Governance Perspectives. We truly appreciate you joining us for these important discussions featuring voices from across the Shar School. For more information and to explore our archive of past episodes, please visit shar.gmu.edu/podcast. Thank you for listening, and we look forward to sharing more with you next time.